Hey there, this is Rick Thomas with Thomas Family Insurance for week 5 of your Medicare Monday. In this video, we're going to take a look at a term that people hate to hear, but it's there for a reason. Today, we're talking about prior authorization and why it's important and also why it's such a pain. All right. So, in the agenda, we're going to have an introduction of what prior authorization is. We'll go over why it's needed to fight fraud, waste, and abuse. We'll talk about some real life cases and what you can expect when and if prior authorization is needed for you. And we're going to compare Medicare Advantage to original Medicare and see why it's clear why doctors prefer original Medicare to Medicare Advantage plans. All right. So, what is prior authorization? Simply put, it's when the insurance company needs to approve a service, a procedure, or a medication before they pay for it. Not everything requires prior authorization, but many of the expensive things will. It's not just about saving cost, although that is part of it. The cost containment is there to prevent unnecessary, expensive, or dangerous treatments that, without an independent review, may not be necessary. Most doctors, I should say many doctors, hate this because they're a doctor and that should be good enough for the insurance company. However, not all doctors are ethical or even competent. This is put in place to help protect you and other patients and the insurance company from the bad actors that are out there. Prior authorization also looks at the medically necessary aspect to see if it's even appropriate. Some doctors are very cut happy, and if someone and they want to get someone under the knife as soon as possible because that's how they get paid. But there might be safer options that will work just as well and without the risk. So when it comes to medicines, part of the issue with prior authorizations help make sure to screen for potential abuse, and some negative side effects or dangerous interactions with other medicines that you might be taking. Most doctors do have a full patient history, but not always. So it's also important that the insurance company makes sure that there's nothing negative that's going to happen as another set of eyes. Most of the time, it is about appropriate utilization. For example, a doctor might want to order an MRI, a CT scan, a PET scan, and an ultrasound, and the insurance company is simply going to question why do we need to have all of those tests when one test will probably be sufficient. If you look at this another way, imagine if you gave your credit card to someone to do your shopping for you, and they have free range to get whatever they think that you need. As much as you may trust that person, I imagine you're going to want to look at that receipt to make sure they got what you needed or wanted. Now imagine if there's a track record of people using your credit card to pay for things that they wanted that you didn't even need or you didn't even get. I'm sure over time you're going to start looking at that receipt much closer. That's what the insurance company does. They do it for a reason. To be blunt, the responsibility of the prior authorization is on the healthcare provider. They need to provide the documentation, and they hate this process and often complain about it, but it's there for a reason. They don't like insurance companies looking at what they do because the insurance companies are going to enforce the rules that original Medicare does not. All right. So again, in a nutshell, prior authorization helps to control the cost for you and the insurance company, and it can be extremely frustrating, but that's why you have us to help you. It's designed to reduce the fraud, waste, and abuse that's out of control with Medicare. We're going to talk more about that later. It also helps to ensure that you're getting appropriate evidence-based care. If your doctor was the only doctor who thinks a certain way, I think it's appropriate for us to question that doctor on his or her methods. Prior authorization is also designed to protect Medicare funds, which are ultimately taxpayer funds. All right, so we're going to take a quick look at some of the issues with fraud, waste, and abuse, which impacts Medicare beneficiaries. And this is the reason why. I'm not going to put all this stuff in print, but a quick Google search showed a few cases recently that kind of demonstrates the issue with fraud in Medicare. So in 2023, there's a Dr. Pandier that was agreed to settle out of court for $1.8 million for unnecessary cataract surgeries. Again, this was settled out of court. In 2023, Dr. Jackson from North Carolina was found guilty for reusing unsanitary medical equipment during surgeries, yet billing for brand new ones. Her fraudulent billing was over $46 million. This case is still pending. There's a Dr. Sabat in Detroit who admitted to fraudulent billing and serious harms to patients. He performed unnecessary heart surgeries and implanted unnecessary medical devices and also falsified records to deceive the insurance companies. This resulted in over $11 million in income to the doctor. That's not total claims, that's just his income. And that doctor was sentenced to 20 years in federal prison for insurance fraud. There's other cases where people performed unnecessary heart surgeries, conducted risky tests to obtain payment from Medicare and private health insurance companies. All right, there are just a few examples of that. So that's fraud. That's when people are outright doing illegal things to try to make money off of Medicare. Waste is a little bit different. Waste is not illegal, but still can become a major issue. Medicare waste is when resources are misused, resulting in unnecessary cost. For example, excessive office visits, prescribing too many medicines, or a high-priced medicine when a cheaper one works just fine, or ordering too many lab tests. While this is not criminal, it does pass on unnecessary costs to patients and the insurance company. Medicare abuse is also not illegal, but also creates some massive issues and problems for Medicare clients. Abuse include practices that don't provide medically necessary service or meet professional standards. It can include billing for unnecessary things, overcharging, misusing billing codes, getting kickbacks, upcoding so they can get paid more, and unbundling, which is basically when they break an event down to smaller parts so they can get paid more for the parts than they would for the whole. Other issues include patient steering, whether it's to medicine or services, corruption of medical decision making, or unfair compensation and referral schemes. Overall, it's estimated that taxpayers lose over 60 billion, that's with a B, every year to Medicare fraud. On average, health insurance providers get paid original Medicare gets billed more than 7.5% than Medicare Advantage plans, mainly because they can get away with it. Okay, so what's the point of prior authorization? Obviously, trying to keep the costs down are part of it, but it's also there to ensure the safety and medically necessity. It reduces duplicate billing and stops unnecessary testing to pad somebody else's pocket. It's also designed to stop unnecessary hospital stays and services. It should prevent billing scams and also limit the abuse in home healthcare and medical equipment field. All right, I'm going to give you a few examples of prior authorization and how it might impact you. All right, in a lot of cases, the MRI is an issue. So, before the insurance company wants to approve an expensive MRI or CT scan, they want to make sure other methods have been tried first. This is called less evasive action. So before a surgery should be done, which is why typically they want an MRI, they want to know, hey, have you tried physical therapy? Have you tried medication? Have you tried this or that or the other? And more common that Medicare Advantage plans will ask if these things have done, and the doctor needs to provide the documentation or try those services first. These rules are given to the Medicare Advantage plans from Medicare. The insurance companies must follow the Medicare procedures, although original Medicare does not. Medicare Advantage plans will also review criteria, alternatives, and more cost-effective ways. This is based upon clinical research across the country, not just one doctor in one area. Not all doctors are going to agree with this information, but it's based upon what other doctors are doing and why. If prior authorization is approved, there's nothing else that's needed. If it's denied, that's what we're here for. We can offer guidance as to why it was denied. And if appeal or grievances are necessary, we can offer guidance with that as well. The majority of the time, in my experience, is when the healthcare providers simply do not turn in the correct documentation. We'll be here to help explain what the options are and what we need to do to get the services done that you and your doctor feel are necessary. There might be extra hoops we have to jump through. I have fought and won many cases over the years with prior authorization. The only cases I lose are when it's dealing with custodial care versus skilled care. There is no winning in custodial care. When it's medically necessary and the doctor fills out the correct paperwork, most of the time we can get it approved even if we have to jump through a few extra hoops. All right, let's talk about skilled care and custodial care next. This is a constant battle and the biggest issue that people complain about with Medicare and Medicare Advantage plans. So, custodial care is when a patient cannot do the activities of daily living. They cannot go to the bathroom, they cannot transfer, they cannot feed themselves. This will not be covered under Medicare, nor will it be covered under any Medicare option. What is covered is called skilled care. Skilled care is when we may need help on a short term basis at a nursing home to get better again. These events are limited to 100 days per admission. Original Medicare will require you be in the hospital for 3 days first. Medicare Advantage plans do not require this. If you need to have custodial care coverage, you need to have nursing home insurance or home health care insurance. Original Medicare and Medicare Advantage plans will not help with custodial care. Medicaid will. All right, so why are prior authorizations necessary? Well, first of all, let me say nursing homes absolutely hate Medicare Advantage plans. They must constantly get approval showing that the patient is there for skilled care and not custodial care. They hate doing the paperwork. They don't feel it's necessary. Medicare will originally not look at the claims, but they can look at it after the fact. If it was determined later that the stay was custodial instead of skilled care, Medicare can reverse the payments. And this will be done long after you're out of the facility. And now you're stuck with the entire bill after you think it was all set and done. So that issue is now on the patient, not on the facility. Prior authorization has helped prevent fraud from keeping people in longer than they should and reduces the overuse of the facility so those beds can be available for those who need it. It will also provide alternatives like home health care and other ways that you can get better without being in a nursing home. It is a necessary part that's hated by all parties. Doctors hate it, patients hate it, the insurance companies hate it, and if everybody did the right thing, these rules would not be needed. But not everybody does, so here we are. All right, so we're going to take a quick look and compare Medicare Advantage versus Medicare Original and talk about how the two work. As I mentioned, Original Medicare does not require prior authorization yet. That is something that's going to be coming over the next few years. That prior authorization is there to help, but it does often feel like it gets in the way. The vast majority of doctors are very good and they do the right thing, and those who do not make it difficult for the rest. The abuse in skilled care, home health care, and durable medical equipment forces the insurance company to look closer. Those free scooters or those free items for people on Medicare are not free at all, but it's paid for by taxpayers. Too many times, people are there to take advantage of a broken system, and prior authorization is designed to protect against it. The biggest difference between Advantage plans, they will follow utilization control. They have rules and procedures and to control cost prior to the services. Original Medicare is a fee for service, and this creates the open door for bad actors. In a nutshell, prior authorization is a necessary evil. To make things worse, many carriers have outsourced their prior authorization to other companies so they do not appear to be the bad guy. Not all outservice companies are equal, and it can be an even greater pain when the insurance company is not directly involved. However, that's what we're here for. While I cannot access private health information for you, I do know people and I do know things. Just because someone says no does not mean it's a no forever. There are solutions to almost every problem. In some cases, denied services do not save money, but it's for the safety of the client. There are many reasons why a denial may occur, and understanding that reason why is the first part to fighting back. Overall, prior authorization is to protect taxpayer funds that go to Medicare Advantage plans to keep plans affordable and as a good option. You compare the cost of Medicare Advantage plans to Medicare Supplement, and you can see the difference. Supplements will only cover 20% of what's left behind of Medicare, but the premiums constantly go on up. Early estimates for this next year is most Medicare supplements are going to see an increase of 25% or more on Medicare supplements. Medicare Advantage plans have been much more stable. If Medicare had prior authorizations, then perhaps that increase on Medicare supplements wouldn't be so bad. All right, that's your Medicare Monday for week 5. This is Rick Thomas with Thomas Family Insurance. Again, on your screen, you see my cell phone number. That remains the best number to reach me. That is a direct link to me. I almost always have my cell phone on me. However, I cannot always answer it, so leave a message if you call. The office, 217-771-1722. That is Trish's number at the office. She works Monday through Friday, now 9 to 3. She cannot always answer the phone because she's talking with someone else. So leave a message if you reach her, if you need to get a hold of her and she doesn't answer. We are here to help, whether it's prior authorization, understanding your plans, helping your friends and family navigate their Medicare maze. That's what we're here to do. Thank you very much. I appreciate your time. You have a wonderful week. God bless. This is Rick Thomas with your Medicare Monday by Thomas Family Insurance.